Hi, I'm Stacy Jean-Claude, Outreach Program Manager for the Kidney Transplant Program at Mass General. I'll be reviewing the reasons why you should choose Mass General for your kidney transplant care. From volume and outcomes data, access to innovative research and resources, our unique approach, and our world-class team. The MGH Transplant Center is the largest transplant center in New England. Our doctors have a lot of experience performing more than 3,800 kidney transplants and counting since our program started in 1968. The number of transplants a program completes is important to measure when you're evaluating transplant programs. We performed 165 kidney transplants in 2021 alone, which is about one transplant surgery every other day. And of those transplants, 67 were from living donors. You also want to look at what happens after the transplant, the outcomes. The Scientific Registry of Transplant Recipients, also known as SRTR, is responsible for collecting and publishing outcomes data from more than 250 transplant centers within 11 geographic regions across the country. Mass General is in Region 1. Adult graft survival looks at organ survival rates after transplant. According to SRTR, Mass General performs better than our expected rate and nationally, with 97% of transplanted kidneys surviving beyond the first year. Similarly, our patient survival outcomes outperform what is expected of our center and what we see nationally, with about 99% patient survival after the first year of being transplanted. We encourage you to review the most recent outcomes data by visiting the SRTR website here. We also share this data with patients who are evaluated at Mass General. Another advantage of choosing care at the MGH Transplant Center is access to cutting-edge research studies in the field of transplantation. Mass General is home to the largest hospital-based research enterprise in the U.S. We lead research in areas including new immunosuppression regimens, tolerance transplant protocols, and xenotransplantation, which is the transplantation of organs from other species. We are also looking at increasing and expanding the use of organs through using hepatitis C positive organs and the HOPE Act, which allows organs from HIV positive donors to be transplanted into HIV positive recipients. We are involved with exciting research studies involving biomarkers to detect sooner kidney transplant problems and kidney disease recurrence. The Mass General Hospital Transplant Center is proud of our research portfolio, and as a patient on the MGH waitlist, you will have unique access to clinical trials and research studies. Visit our website to learn more about our research studies. You'll also have access to a dedicated care team, including transplant nurse coordinators who work diligently to support you throughout your transplant journey. The team also includes our world-class transplant nephrologists and surgeons. They are the leaders in the field and provide outstanding care to all of our transplant patients. Relationships and expertise of our care team at Mass General is superb. In addition to the one-on-one relationships our patients have with the transplant nurse coordinators, they also have several resources available to them. Some of those resources include support groups led by social work, educational opportunities, and coaching, to name a few. The team works with and for our patients because quality care and education are central to everything that we do at Mass General. This commitment to excellence and continuous improvement goes far beyond the care that our transplant team provides. Each year, we identify important program priorities. Expedited listing cuts down on the time it takes to get patients on a wait list. This allows patients to start accruing time sooner. At Mass General, we strongly encourage early referral to transplant because research has shown that people who receive transplants sooner, ideally before starting dialysis, have better survival rates and quality of life. Another priority of our team is access to quality care and transplant to all patients. We do this through our kidney evaluation outreach programs and the MGH Equity and Kidney Transplantation Initiative, the latter established to address the disparities highlighted by the COVID-19 pandemic. You can learn more about these programs by visiting our website. As an academic medical center, learning is part of our culture. This is who we are. We hope you can see that our team is very committed to providing the best transplant experience and outcomes to our patients. Thank you.